Do you know this movie? Have you ever heard about this movie? Save Private Ryan. It's a morning, we try to play a game together. It's not Saving Private Ryan, but our game will be Save 200 million Chinese elderlies. And we try to do the game, and in fact, this is a simulation game of what we did during the past 12 years in 4 countries. So I want you to be with me and try to simulate what we have done together. So the game is, we have in China more than 200 million elderlies. You know that the situation is really time bombing because in 2050 there will be 500 million of elderlies. And in 2026, for the first time in the world, there will be more elderlies over 60 years old in the world than young adults below 25 years old. So this is really critical, and we need to think carefully about how to solve that. Among those 500 million, we know that in 2050, 60% of them, which is 300 million, will require some help. So when you think of the game, you think also that the life expectancy in China is almost the same than Poland, 75 years old, in Poland 77, and in terms of a healthy life is around the same years, 68 years old. So the aging will be unhealthy for around 7 years. If you think also of the game, think of the problem you have to solve. Because in China, there is only one child to take care of 6 people, and also among all the elderlies, 60% are already living alone. So if you are one of those children, and you have to be careful about your parents, what will you do? In terms of also elderly care, you have also a shortage of already 10 million of professional senior caregivers. This is also visible in the geriatric hospital. In China, you have around 12,000 hospitals, public hospitals, and how many of them are taking care, specialized in elderly care? Only 61. And if you think of next year, in 2020, there will be only 4 beds for 100 people in a nursing home. So when you are with me now, try to think of how is it possible to take care of those elderlies if we consider all those difficulties. Today the situation is like that. If we're going to the hospital, it's very crowded, and for at least one meeting with the doctor, you have to wait at least 4 or 5 hours, and it's very crowded. In terms also of insurance, there is a very special case in China because the elderly over 65 years old doesn't have a private insurance. I don't know what is the situation in Poland, but over 65 years old, nobody wants to insure them. But the good news is, in the game, there is not only difficulties to solve, there is also good news. The good news is about the business itself. The Chinese aging care business, as you might understand, is really booming. In terms of potentiality, we are going from $600 billion to the next future will be $1.6 trillion. So there is a very good space for you if you are in elderly care, technology, or premium insurance, because they don't have insurance. If you are in AI data related, you have to think of how is it possible to bring your own value into this wonderful Chinese market. Because in terms of, if we think of the insurance, only the insurance, the growth, annual growth is around 30% per year, and the people who are able to buy this elderly care for the parents, BCG Group has done a wonderful study and said that those people who are buyers, potential buyers, are around 38 million in China. So now, let's come back to the game and think of the purpose of the game. Our game will be to bring to those elderlies, and this is, by the way, the dream that I have and I want to share this morning, is how is it possible to help them to have a longer but happier and also healthier life. And the aim of that is also we want to be the worldwide game changer in elderly care. The purpose of the game will be also very clear. You remember that for the past 7 years, the elderly will decline until they passed away. And so the purpose of our company that we will do together is to increase this healthy life expectancy. Because nowadays, we don't live at home after retired only 5 years like it used to be in the past. Those days, we are living around 20, 25 years, which is an entire generation life. So we need to understand how is it possible to use this best of technology with AI, robots, digitalization to use this technology to help them to have a longer, healthier life. And the three major problems that we were thinking to solve is first, having a preventive healthcare. Because today, when we think of elderlies, all the healthcare are only focused on the problem that they have, which is, if I have a heart attack, if I fall down, then they're gonna help me. But what if we use this AI, all this digitalization, before the accidents came? And that is the purpose of having this preventive healthcare. The second thing is, when we think of the elderly, the first number one killers everywhere in the world for the elderly is what we call a cardiovascular issue. And one of the biggest is heart failure. So the question will be, how is it possible to use the best of the technologies, including AI, to solve this heart failure for the elderly, knowing that it's deadly and very harmful? And the third is, of course, for China, is if they don't have insurance after 65 years old, a private one, how can we cope with that? So now, the resources that we have is 4 countries. Marianne, yes, before she said that we need to go beyond our borders and think big to solve the humanity issue, and it's exactly what we did. We spent 4 years in each country, which is a combination of 12 years. The resources that we have is this hospital in France is one of the top in the world because he received already 4 Nobel Prizes. We call it University Hospital of Strasbourg. The other one, these 2 are my engineering school, one in France and also here, where I'm also doing my PhD. And this one is the MIT, Canadian MIT called Waterloo University. So the dream team is located there and divided in 2 skill set. One are AI robotics, and the other one are more related to healthcare, and especially cardiology. So now we have tools. Stay with me with this toolbox, and the game will be, we have, and you already saw this kind of IoT, Internet of Things connected device, for example, the blood pressure meter or other stuff. We have also in our toolbox this kind of IoT cloud computing, and we have also this artificial intelligence with different kind of algorithm. So the question is, how do we collect them to find a proper solution to our mom? And by the way, speaking of which, this is my mom. I was born in France. Why? Because my mom comes from Korea. She did a PhD in France, and she became a doctor, and she spent all her life as a doctor in Paris. But after that, she decided to be retired in Korea. And my father passed away, so she's living alone in Korea. And I'm working as an entrepreneur already 10 years in Shanghai. So the question and the issue that I have to solve is, how is it possible to take care of my mom when she's in different city, different country, and I'm another one? And by the way, in Shanghai, Beijing, half of the population have the same issue than me, because half of those people living in Shanghai are immigrant people coming from different parts of China. And so we share all the same issue. And we finally have the same dream. How is it possible to help our mom, our dad, to have a not only longer life, but also more healthier and also happier? So the first thing what we did is think of the heart failure. Remember, one of the issues that we have to solve is the heart failure. And not only that, we wanted to have a total solution, which is first based on identifying the risk, and this is important. From the how do we do that? We partner with one of the biggest DNA testing company in China. They already did more than 100,000 DNA testing, and from that we are able to identify the top 20 risks of those elderlies. Then, when we have those knowledge of the 20 top risk of the elderlies, we are able to do this kind of disease management and also monitoring. So monitoring, we use different kind of IoTs. We monitor the health, and then after that, what we're doing is we use our technology, and I will show you how, to predict the heart failure. And after that, because they are not covered, we were very happy to do a wonderful partnership with the #1 insurance company in the world, AXA, to give them a medical teleconsultation at home 24/7 and also give them this assistance. And we're happy also that, and this is something I want to share, is when we have a big dream, we cannot do, especially this aging care is so big, 200 million plus elderlies, is so big that our startup and our few people, even in the 4 countries, are not enough. So the important thing I want to share is we need, especially as a startup, to build our branding consolidation. Because people will question us, hey, you said you're gonna save those elderlies, but who are you yourself? Is it self-proclaiming that you are healthcare digital, one of the top, or is it other who can endorse you? And one of the sharing that I want to give you this morning is, as much as possible, try to find these high top level players in the world that can endorse you. And one of the good way to do it is to apply for international worldwide contest. We did that for Bayer, and we were happy to, with Selina here, who is the Greater China president, we were happy to be the winner in China. And now they sponsor us with our robot here. Will be at home. And this robot that you see here he's connected already with different kind of IoT, and this gentleman every day will use these IoTs for 5 minutes a day, no more. And then, after that, we will do this analytics. And the analytics has been backed up scientifically with this professor, Professor Andres, who is, by the way, my PhD professor. And the good thing is we did 4 years clinical research in this 4 Nobel Prize hospital with 800 elderlies. And at the end, we were very happy to find that it's possible to detect 6 days ahead a heart failure. We have 15% negative false alert, but we are 100% accurate on our algorithm, and it is now used in France and also in Switzerland. And our goal today is to bring this wonderful technology, encapsulate this technology in our robot. And now, the benefit are very important, because we can save 70% of the duration of hospitalization and also 70% at the hospital, the fees. So just show you quickly how does it work. We have different kind of measures here. We have one alert here. At that time, the elderly, we will advise the elderly with a nurse to go to the ICU, in emergency hospital. If she doesn't go there, then you see the evolution until you get the heart failure 6 days later. So how do we, the final conclusion that I want to share before leaving you is, when we think of AI, all technology, and especially for the healthcare related, we have to think of three things. One is the environment. How does it affect our health? Sometimes it's not possible to live and to move to other country. So where can we trigger something to have a better health? Sometimes it's changing our lifestyle. But when we think of changing a lifestyle, sometimes is how can we be sure that when we monitor and we analyze, it is the right lifestyle? So then we need artificial intelligence. But at the end, if you or some of you are involved in healthcare AI-related project, my conclusion will be, never forget at the end that the technology, AI, are helping the people. And it's not the upside down. We are helping the people to have a better behavior and lifestyle through this artificial intelligence. And the most important is not the technology, it's still the people, and the loving people, such as our mom or our elderly, that we want to help them to have a better, longer life. Thank you.